Don't break your lens because I'm fugly. You know what fugly is?
Yes.
Yes, you sure do, Dave.
So, at the beginning of every statement, scene safe, BSI, have gloves on, nature of illness, mechanism of injury. I'm at the trauma station, so my clue is it's probably a mechanism of injury, right? Give me additional resources, fire, police, ALS, because I don't really know what I have yet. I can always cancel them. And since this is there any reason to hold C-spine? This is a trauma assessment. I'm sure there will be as soon as they give me the scenario. They will give you a scenario, hit by a car, fell off a ladder, whatever the scenario is. Okay, partner, go hold C-spine. Since my patient is a trauma patient, and I'm not sure, and it looks like a high energy mechanism of injury, I'm going to do a rapid head-to-toe trauma assessment. My primary assessment has to come first. What is my general impression? What do I see? And they'll tell you what you see. A 22-year-old male patient in the parking lot of Walmart got hit by a bread truck leaving at 25 miles an hour. Okay, patient still laying on the asphalt. Patient appears to be unconscious. Appears to be unconscious. Sir, fire department, what's going on? Did my patient respond to me?
No.
Yes or no? If they say no, then my patient is unconscious. If they open their eyes and looked at me, my patient's probably conscious and alert. You're going to have some that are going to be conscious, some are going to be unconscious. Do your CABs, ABCs after that. This guy appears to be unconscious, so I'm going to do CAB. I'm going to check. Do I have equal pulses from the radial and carotid? Yes, no, whatever. Okay, airway, is my airway open, clear, maintained at the moment? Since the patient's unconscious and didn't talk to me, I have to ask that question. If they were conscious and responded to me, that answers open, clear, maintained. Okay? Breathing, is my patient breathing well enough? Do I see good equal chest rise and fall? Do I feel air on my face? Are they breathing well enough to sustain life at the moment? Yes or no? Well, even though he may be breathing well enough to sustain life, I think I want to place my patient on, since it's a trauma call, he might be going into shock. I don't know yet. Upon further assessment, I can always cut it back if I want to. I'm going to put him on a non-rebreather at 15 liters. Circulation, also the skin. The skin that I can see at the moment, what do I see? What does it look like? Is it pale? Is it pink, warm, and profused? What does it feel like? What does it look like? They'll give you the answer. You got to ask these questions. So, high priority patient. I just finished my primary assessment. I did my scene survey and my primary assessment are all done now. So I'm going to start doing, while my partner is holding C-spine, I'm going to do my head to toe. I'm doing a head to toe rapid trauma assessment looking for
life-threatening injuries.
Pardon me?
Life-threatening injuries.
Well, no. Yes, but I'm looking, what's the acronym we're looking at?
DCAP BTLS.
What is it? Deformities, contusions, crepitus, abrasions, punctures, burns, tenderness, laceration, and swelling. Now I can decap BTLS the rest of the time. I don't have to fucking spell it out. Because most of us will let you go to about here and go, what's that mean?
Okay.
And it screws people up when you stop them halfway through, or something like that. So, starting at the back of the skull, I'm checking decap BTLS, any deformities, any contusions, any crepitus, nothing, they'll do yes or no. I'm checking the C-spine, I'm running that. Do I feel step off or anything back in there that's unusual? Any decap BTLS? Yes or no? I'm going to the front of the face, I'm checking all my facial bones, I'm checking my pupillary reaction. They either do or they don't. They'll tell you. I'm looking up the nose to see if I see any clear fluid or blood. I'm looking in the ears, checking. I'm opening the mouth, looking for any loose teeth or anything that could occlude my airway. I'm now finished the head. I decap BTLS the whole face and head and C-spine. I'm checking my neck. I'm checking for symmetry. I'm checking for JVD. I'm checking for tracheal deviation. I'm looking for a stoma, maybe medical necklace that might be on there. Since he's unconscious, might give me some information. Yay or nay? Okay. Everything's negative or they'll tell you something. I'm checking the back here, behind his shoulders, pull my hands out, any blood, any decap BTLS. I'm checking my collarbones to make sure they're stable. Collarbones, clavicles mean collar. I will measure, I will put a collar on. Okay, collar's on. Now, I'm going to encircle my patient's chest and feel for equal chest rise and fall. I would have also said I'm going to partially expose my patient so I can see this stuff. Checking for equal rise and fall. I'm down now palpating the chest for stability, decap BTLS. Okay, if that's negative, I'm moving on to the abdomen. The 4 quadrants of the abdomen, I'm now going to palpate. What are we checking for in the abdomen? Checking for distension, rigidity,
Guarding, pulsating masses.
Well, yeah, any guarding, distension, rigidity, any pulsating masses. That's negative. I can move down here. Did we teach you the pubic symphysis?
Yes.
Okay. Checking the pubic symphysis for stability. Yay or nay. I'm checking the hips. I'm pressing in, then I'm pressing down. Checking for stability. I'm checking for buff, blood, urine, feces. I'm moving down to the leg. I'm encircling. Oh, first I'm going to do, this is something I do that they don't.
Priapism?
Huh? Oh, priapism also, yes.
You did the motion.
Oh my God.
This is something I do, Jason doesn't teach, but the first thing I do for the leg is I push the opposite way. One on the inside, one on the outside, and I do that. Check for stability of the bone. I do that. That's the way I teach it. So, okay, now I'm encircling the leg, checking for decap BTLS, any blood? No. Checking the knee, make sure that's intact, no injury there. Checking for blood? No. Checking the bottom of the leg, decap BTLS, checking for any gross blood? No. Pinning the ankle down, I'm checking for my postibulus pulse. Is it present? Yes or no. Dorsalis pedis? Yes or no. Sir, can you feel which toe I'm touching? I'm doing my PMS on this now. If you've done